And one of the providers actually brought paper and like thousands of pages of paper and dropped it like in front of me.
How did you find your way into this space and what drew you into it?
My own journey is similar to a lot of folks listening's journey or soon to be journey. That journey was just from my own personal experience, finding something maybe that I wasn't that great at. And my undergraduate degree is in healthcare, which is why I started in a hospital setting. And in that experience, I was really excited as a recent graduate. I thought I could conquer the world. I'm going into these healthcare systems and I'm starting to see some gaps. And one of the gaps was the data. Yes, this hospital system had electronic medical records. They had offices all over the place and the physicians were trained to use that system. The complex part of it is when you're asked to report on each physician's practice to get patient levels, volumes, what they're being seen for, the amount of time they're being seen. Sure, that sounds like maybe an easy report to some individuals to report back to the healthcare system on how each physician's doing, but it's really a human-centered problem because even though this is a report and it's going to go to whoever makes those bigger decisions, it also impacts or has the potential to impact individuals' care. And so it's a human problem. And that's what made me just start to think, okay, well, if this is a human problem, I need to go and talk to the actual providers to see how they're capturing this data. It's more than just a report at this point. So I met with a couple of the providers, I had them come in and they showed me how they're doing the data. And one of the providers actually brought paper and like thousands of pages of paper and dropped it like in front of me. I was blown back. And he's like, yes, this data in your system is accurate, but I haven't been able to add all this other data to it because I'm so far behind taking care of my patients. There's just not enough time in a day. Seems reasonable. But now think about that at scale. So how do we report this? So bringing this back to my own upskilling and reskilling journey, I realized that I had a lack of data literacy. It wasn't from not understanding what data is, but it's from not understanding how data works in an ecosystem. So I wanted to set out to try to not only enhance my own data literacy, but figure out ways to automate this data ingestion issue, not only to help the system, but I'm assuming if this healthcare system's having an issue, other organizations must be.